work towards professional development for our own occupational therapy in Indian context. And then also thanks Karthik for asking me to talk about it, and for the generous introduction. So I'm going to share my screen. Let me know if you can also hear me well, Karthik.
Yeah, we can hear you, and I think you're. Yes, I could. It's coming up. Yeah, we could see your screen. You can put it on a full
Perfect.
slide mode. Yeah.
Great.
Yep.
Okay.
Perfect.
Fantastic. Is it full
Thank you.
screen now?
Yes.
Right. And the recording is on as well, right?
Yes. Yes.
Perfect. Right. Very good evening to everybody from India, and greetings to everybody in different time zones in around the world. And as I said before, I'd like to uh, first thank Indian Occupational Therapist Think Tank for providing me with this prestigious opportunity to talk for their occupational therapy uh, World Occupational Therapy Day celebration on this important topic. I'm also a part of the board for Indian Occupational Therapist Think Tank, so it's kind of a homely feeling for me, both from being in IOTTT as well as being an occupational therapist from India. It's always an important feeling, very accomplishing feeling to say that I'm an occupational therapist trained in India, and this topic is again very close to my heart, and also to all participants, I believe, who are here to know about how can we reimagine occupational therapy professional development in India. I'm currently the vice chair and the director for international affairs at the Royal College of Occupational Therapy in the UK. So I'm going to share a little bit of experience from there, but predominantly I will try and talk about our context and professional development for occupational therapy in India on this celebration from Indian Occupational Therapist Think Tank. So this is going to be the objective of my talk. I'll present the situation of how professional development for occupational therapy is in India currently. I will highlight some strategies that we could look at reimagining, and also kind of will request a wider discussion from you all as well. First thing is, I would like to say our profession is a science, is not an art. So I love the statement from Henry Poincare 200 years before, where he said, if you're looking at any profession and science in that profession, you have to believe that science is built up of facts as a house is built with stones. So, but a collection of facts is no more a science than heaps of stones in a house. You know, so if you're looking at science, it has to be useful, it has to be relevant, and it has to enable the professionals grow with the science. But if you look at the science of occupational therapy from an ideal situation, this is how it should be. So if you're looking at each piece of stone as one piece of evidence to build the science of occupational therapy, obviously you're looking at a big house or a small house, but all of these evidence are added together to build that specific house of science in our own profession. And I would love to actually see in India, we are also doing the same. We are kind of looking at occupational therapy as a science, and each bricks that we have for our house is going to be a piece of evidence that will actually build a profession in our country. So this is an ideal situation that everybody would want to look at or reflect on the specific statement I showed you earlier. So science is built up of facts, like a house is built up of stones. However, as I also said in that same statement from Henry, heaps of stones is not a house. You can't live in the space. So if you look at generating evidence and then come up kind of piling up evidence on top and then not using it to build a science of your profession or build a house for your own profession, it's no more science, isn't it? So I believe we are in a situation currently in India where the science of occupational therapy is actually looked at both internally within the country as well as externally, as people are looking at generating evidence and then compiling it as a heaps of stones rather than building a house for our profession in our own country. I might be wrong, but please let me know what you think at the end of my talk as well. I'd love to hear more from you. If you look at the global snapshot, this is what it is in terms of our profession. So we have about 680,000 practicing occupational therapists in the world, which means about 7 lakh population are occupational therapists in the world who are practicing. We have about 1,036 educational programs approved by World Federation of Occupational Therapists. We also have significant amount, okay, of the 1,000 we have about 35% of the education programs coming from non-WFOT approved uh, universities and colleges. And if you look at how many people on an average are there in the whole world, for 10,000 people with any kind of rehabilitation needs, we only have 2.5 occupational therapists. So for every 10,000 people who need occupational therapy, we only have two people to cater to their needs. And if you look at the number of students coming out from occupational therapy programs every year, it's about it's accumulated currently to be around 126,000, which is one quarter a lakh population. And we also have somebody called occupational therapy assistants in high income countries. We don't have that in an Indian context, but they are also significantly high. But when you compare even them and the practicing occupational therapists and the students together, despite of all these huge number of occupational therapy enthusiasts, you see only 2.5 occupational therapists there for 10,000 people who need our services. I'm just going to show you the regional snapshot of this. I showed you what is happening globally, and most of the data for me in the specific talk is coming from the WFOT Human Resource Project. In this specific slide, I'm showing you the regional snapshot where if you see an European region like United Kingdom, you have about 44,000 occupational therapists for 69 million population. In America, we have about 150,000 occupational therapists for 340 million people. If you look at Japan, you have about 100,000 people or 100,000 occupational therapists for about 124 million people in the Western Pacific region. But if you look at Southeast Asian region, which comprises of two big countries, which contributes to significant population of the whole world, we have about, in India exclusively, 16,000 occupational therapists for 1,400 million people in that country, which is astoundingly big figure because we are looking at very minimal number of occupational therapists in a country which has got exceedingly high number of people who are living in that country. So this is something that we have to think about when we are starting to think about how do we look at professional development in India. So this is first something that everybody who's there as participant in this group should start or use this as a start point to look at where and how we can develop the profession in India. If you look at the global issues, these are three key global issues. All right. The issues are related to the shortage of occupational therapists worldwide. And the three key reasons behind this is number one, whatever is the wages for occupational therapists is not really satisfactory among the people who are delivering or catering to the needs through occupational therapy services. Number two is awareness and recognition of our own profession worldwide. Okay, it's not just in India, but worldwide, the awareness and recognition is very limited. Last but not least, it's also prioritized, which is the supply of experienced occupational therapists. So it's not about whether I finished occupational therapy course and I've been a fresher, but how many occupational therapists are actually experienced and have expertise to cater to the specific needs of the population for the whole world. So these are the three key reasons why we have shortage of occupational therapists around the world. If you look at the regional issue, what is happening in Southeast Asia, for example, obviously the key problems or problems that are significantly related to the shortage is mentioned here. I can basically share the slides, and IOTT will be glad to share the slides with the participants as well, because you're all members mostly from IOTTT. But if you look at the different reasons in different regions, it's varied, isn't it? In Sri Lanka, education is the problem because of which we have shortage. In Bangladesh, you don't have people who are looking at community occupational therapy. In Indonesia, again, it's related to school services, pediatrics. In Bhutan, there's only one college which has been recently started. We are looking at inpatient and outpatient hospital setting and service delivery as well as educational issues. But please look at India. You have issues in relation to all specialities. Okay, so this is the key issue. India, being the largest populated country in Southeast Asia, has got issues related to anything that you name as the reason behind the shortage of occupational therapists to cater to the needs of the population in their own country. If you look at key national issues, now I'm moving on to India. I showed you about the global situation. I showed you about the regional situation. So some of the key situations we got to look at the national level is look at first the number of occupational therapists who are members of our national association. So I showed you in my previous slide, there are about 16,000 occupational therapists in India. All right. Of which only 3,000, which is not even 20%, is the number of occupational therapists who are actually registered and are members of our national association, which strives towards professional development. So, of the 100 people, if you have only 20 people or 15 to 20 people as members of an organization striving towards professional development, where are we looking at professional development in our country? So what is happening to the remaining 80-85% of the population who are occupational therapists and who are not registered? Why are they not registered? These are some things that we should look at. So this is a key national issue in terms of membership. If you look at education, this is what is the important finding. So it's very clear that if you look at annual graduates, okay, on an year, how many people are actually graduating from WFOT approved educational programs? You see 1,800 people. All right. But if you again look at how many people are actually graduating per year from a non-WFOT approved program, it's 500. Which is kind of one third or 25%. So you have 100 people, of which only 75% are from graduates or occupational therapists graduating from WFOT approved program, and 25% of them are actually graduating from a non-approved program. But altogether, if you see, in an year, we are actually generating 2,300 to 2,500 occupational therapists. And we have been the member for WFOT since 1950s. Imagine if this is the annual turnover, how many occupational therapists we are producing in our own country to meet the needs of the population, and what data we have, as I initially showed, in terms of how many people are catering to the needs of our population. Again, if you look at education programs, so these are the education programs that's available from WFOT approved education programs and non-WFOT approved education programs. Again, significantly, if you see, if you have 30 education programs, you have 22, which is more than 50% of the programs are non-WFOT recognized programs. So what is happening to these occupational therapists coming out of or graduating from non-WFOT programs? Are they competent? Are they skilled? Are they qualified? How are they treated around the world? How are they treated in India? Are some of the key issues that we have to look at. But when you look at all these data, something that is essential for us to think about is this specific statement in the slide. I love the statement because it gives us a clear picture of how do we build signs of a profession in a specific place and where to start with. So it says medicine seems to consist of a few things we know. A few things we think we know, but we probably don't, and loads of things or lots of things we don't know at all. You know, um, so if you are replacing the word medicine from by occupational therapy, you can very clearly say occupational therapist or occupational therapy seems to consist of few things we know as occupational therapists, a few things we think we know, but we probably don't, and a lot of things in occupational therapy we don't know at all. And if you look at the left-hand side of the slide, you have four windows. I'm sure everybody will know Joe Harry's windows. It also depends on if you want to reimagine which window are we all looking at, which window have we actually looked at as an organization, as an individual, as a student, as an academician, or as a higher education institution, or a research institution, or a researcher. So I think this will be the best start point for us to reimagine professional development for occupational therapy in India. And if you want to look at the same window from an occupational therapy professional development, I would say we got to look at reimagining research, education, and practice from one of these windows. Um, if I may ask you at this point, how many of you think which window is the best window for us to reimagine our professional development in India? Can you all put it either in the chat box or kind of unmute and then speak for me, please? Which window do you think we should look at for professional development in our country? Anyone?
Suresh, I would say, in my view, we should focus more on the blind spot and the mask. I mean, I would say both windows to start with, because that is something like, we are like a 75 plus year old profession in India now. But it is not like an unknown, because we have all this literature practice going on for decades now. But still, I think there's a lot of lack of clarity in my view.
Mm,
A lot of things are masked that need to be uncovered, and also a lot of lack of awareness, in the sense even among the practitioners, the lack of awareness about the systems that influence delivery of practice and so on. So yeah, I'm kind of going towards both windows. Thank you.
okay, if I give you an option, Karthik, to choose only one, which one will you choose?
Um, I would currently say we need to unearth in order to become more aware of our blind spots. So I would say
Oh,
masked.
okay. So you're saying masked.
Yeah, I mean that's what I'm leaning towards. Like we need to
Okay,
first unearth a lot of things before we even become more aware of our blind spots, and then clarify that, and then go for unknown, and then create more new practice areas and avenues, and
sure,
expand the field.
sure. Do you have anyone from chat box or anyone else who would like to unmute and speak? Which window would you look at our professional development in India?
Suresh, one person, Mr. Senthil Vadivel said research, and
Okay.
then someone else is typing. So when it comes up, I will let you know.
Okay. So
Uh,
the window in which we have to look at. So we can obviously look at research. I did not talk about it because we never tend to give importance and priority, especially in an Indian context, for that specific aspect. And hence, in my initial slides, when I wanted to uh, kind of show you the data, I showed you more data about practitioners and education. Anyway, if we move on, what I would like to say is the window that you choose. Godandan, yes, please.
Suresh, yeah, I think it's a practice I would choose um, through maybe through the mask window.
Okay. 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 Great. Thank
Yeah,
you. Thank you
because
for
there
that.
are a lot of, yeah, thank you.
Thanks a lot. So why I was talking about your choice in terms of the window is only your choice will help you understand the logic you're trying to impose. So now when Karthik said, I would like to look at between the blind spot and masked, he gave an explanation. And he has his own views about why he is looking at those two windows for our professional development. In similar way, we had Godandan also saying masked. So as an individual have your own logic behind why you are trying to look at professional development, either research or practice or education, from the window that you choose. Okay, so you have the logic behind it, and that is like this. When I was in India, when I've not traveled anywhere else outside India, I used to think that all swans can only be white. That's the logic I had imposed, because I am looking at all white swans and I'm thinking that, okay, it could be a blind spot, it could be a masked window I'm looking at, but my logic is, uh, I'm looking at white swans and I'm thinking that all swans in the whole world can only be white. So that's my logic. That's how whatever we are looking at for occupational therapy in India is also kind of fixing us think that whatever we are saying is the logic behind professional development. And this can be individualized, this can be very very clear between, and there can be differences between academic institutions thinking about these kinds of logic from which window they are looking at. It can be for practitioners, it can be for rehabilitation centers, it can be for higher education institutions, it can also be for associations. Indian Occupational Therapists think tank will have a different logic to impose depending on the window it chooses. And say All India OT Association may also have its own way of looking at choosing a window and then providing their own logic. However, I am suggesting, with my experience and understanding from global scenarios, that um, reimagining occupational therapy professional development in India requires us to look at professional development exclusively from a window which is called blind spot. Okay. The reason is, when we are looking at the blind spot window, we are starting with an understanding that I don't know anything about how to reimagine occupational therapy professional development in India. Okay. However, I am believing that everybody else other than me knows everything about how to reimagine professional development, which means basically I'm looking at this thinking that I don't know anything about what to do, but I believe many people rather than me knows everything about how to reimagine occupational therapy professional development in India. If we have this specific uh, idea, and if you look at professional development from this specific window, thinking that I don't know anything, everybody knows everything, I think that's the best unbiased window in which you cannot push your thoughts into it, because whatever you're going to learn is coming from not you, but somebody else outside. Unfortunately, in terms of many institutions, whether research or higher education or practice institutions, we do not tend to look at the blind spot. uh, Rather than the blind spot, it will be just the opposite, which is the box on the left hand side to the blind spot, where we think I know everything, nobody else know anything. you know so that's the spot we start off with usually. But I think it's better for us to reimagine occupational therapy professional development in India. We got to think about, uh, from this specific window, which assumes or which advises us to assume that I don't know anything. I'm going to actually look at others for understanding the answer to this in any of these three areas. Some of the priority areas for us to reimagine, especially in terms of education and practice. Occupational therapy research, it's got its own scope. It's tremendous. And it's very optimism driven as well. Meaning, if you want to do research properly and to add one strong good brick to that house of occupational therapy science, you can obviously do it. There's nobody going to stop you. All right, but to get educated, to provide education, at the same time to practice based on evidence, and to provide good quality services to those who need occupational therapy, I think the priority areas for reimagining are these six aspects. And all these six aspects reflect on the health systems and reformation that is happening in the whole country in the name of health and social care. I'm just not going to talk about each of it in detail. I'm looking forward to the discussion. But what I'm trying to say is, if you want to reimagine occupational therapy, education, or practice, you got to look at strategic leadership and governance. you know how is education provided, how evidence based is the education? Is it competency driven? We can talk a lot about documents that are circulating in the whole country about evidence based curriculum and all that. To me, what is evidence based is, can you help somebody uh, in terms of enabling them to get back to their normal activities of daily living because of any specific condition that they are coming to you with? All right. And then ensure that after they leave you and then they go home, they are not going to come back to you for the same purpose. You know, we treat loads of people with a problem, and we believe that whatever I am doing, I can do whatever I can only within the boundary of four walls in the name of rehabilitation center. And once you finish your service and then discharge them from your services, are you thinking about, are they able to actually independently engage and then be a productive human being, which is the science of occupational therapy, you know? It's not about what I can give, it's about enabling them to independently be a productive member of the society. So, do we have strategic leadership and governance to enable that happen? Are the students really happy about what they learn in occupational therapy, even though they learn for 4.5 years? We have to look at evidence-based data and information. Whatever I showed you, I said 16,000 occupational therapists are the data that's coming from World Federation of Occupational Therapy. But if I ask you, even for one single state in Tamil Nadu, state in India, for example, Tamil Nadu, you have so many educational institutions, you know. If each education institution kind of admits or has about 50 people studying occupational therapy, okay, whether it's bachelor's or master's or PhD, don't worry. Imagine how many occupational therapy colleges are there in India. Even according to WFOT, we have about 100 colleges, or say 50 colleges, and 50 into 50 people, you will definitely have loads of people just from one state contributing as occupational therapy practitioners. But do we have a data? Do we know how many males and females are there? Do we know how many researchers are there within India having finished occupational therapy? How many practitioners are experts in pediatrics or neurology or adult rehab or child rehab? We don't have this data. So we need to look at reimagining evidence-based data and information for us to work on the development of our profession in our country. Financing and sustainability. I would like to basically say, or provide an example of Royal College of Occupational Therapy in this instance, where every member, whether it's a student member or a practicing member or a professional member, it could be a teacher or a researcher or a practitioner, we pay every month 2,000 rupees for becoming or benefiting from the Royal College of Occupational Therapists support related to professional development every year month. It's not year as well, okay. We pay around 23 pounds as a professional member, which is coming around 2,000 rupees or 2,300 rupees every month. Whereas if you look at what is happening for us to be a member in IOTA and then do something, we only look at paying once for a life membership, and I'm not sure how much is the money, but once we pay, we become members and we don't forget. So whatever I am paying, say for example, for 1 year, may be the total amount of money you pay to become a life member. And after that, how will an organization survive for professional development? And that is become a reason where we celebrate annual national conferences once in a year, where all the students, all the practitioners, all the researchers are very happy to engage together and then celebrate that event in style, you know. But is that a sustainable way of looking at financing education or practice or research in occupational therapy? If somebody wants to do something, whatever I have heard in terms of the advertisement that's coming up in India is all about somebody giving 10,000 rupees, okay, for somebody to do a research project. That's the maximum amount of money that I have seen for professional development circulating in the name of, say, enabling somebody to do something, you know, which is big. I'm not saying it is less, but have we thought about how do we create our own funds, our own corpus, and then look at our own professional sustainability in our own country or a state? So that's something that we got to prioritize and then reimagine. We also have to look at competent workforce development. It's not about finishing a 4.5 year course and then not knowing how do you work in a government setting, not knowing how to do research, not knowing how to practice with top end assistive technology like robotics or say technological gadgets. So it's about finishing occupational therapy and then doing occupational therapy. Okay, competency in enabling somebody's occupation and enabling them to be productive members of the society is what is very important, rather than making sure that you study occupational therapy and become a specialist in, say, neurodevelopmental therapy or sensory integration. The techniques are important. I'm not saying it's not important. However, it has to reflect back on productivity, reflect back on the meaningful occupations that you have to enable somebody who comes to you to go back to and then enjoy their life. We also have to reimagine policies and public health relevance. It's all combined. When the national or central government says we need to have a AHP policy, what is there in the AHP policy other than the curriculum we are very happy about? Is it regulated? Can somebody make a mistake? Can somebody complain that somebody made a mistake? And what happens to those people if they make a mistake? Okay. Currently, the policies actually say that if you are an occupational therapist and during therapy, intentionally or unintentionally, if you break somebody's leg or hand, it says you have to pay a fine, you can go to jail, you can actually face some consequences. All right. It doesn't say, can you become an occupational therapist and then practice after doing all that? Is there a way to stop that person doing things? We don't have a policy for that. We have 23 national programs in our country, predominantly related to child health, non-communicable diseases, assistive technology, innovations, education, and we spend huge amount of crores and crores of money on all this. Where does occupational therapy sit? And how relatable is this? Are we having policies only on paper? Are we included in those discussions? Who will take forward all those efforts to speak? It's not about when somebody says we use the prefix dr in a policy, and we don't have it, and we are fighting for all that. But if you get a job in the United Kingdom which is going to give you, for example, 1 crore per annum, will you bother about having a prefix dr or not? It's something that we have to think about. Whatever we are doing, is it of public health relevance, or are we just saying I am living by treating patients, or treating population who need me and who comes to me? There are issues related to developing our own policies in occupational therapy, which should be reimagined. Last but not least, if you look at all these pillars, why are we doing all this? Is particularly for enabling practice, enabling development in evidence-based practice, and also providing safe, good quality, effective services to those who come to you. So I think these are the areas. With my experience, I would like to say that we need to imagine, either as an individual or as an organization or as an institution, teaching or researching or delivering to the needs of people who will be coming to you for occupational therapy service in India. If you look at those reimaginations, obviously you will be able to say uh, your logic is changed. If you reimagine with those ideas which I gave you earlier, you would be able to say from my previous logic, all swans are white. You might be able to convert that logic by reimagining and then say that, oh, okay, I did all the reimagining and now I'm able to actually spot a black swan. So now your overall science and logic you imposed might change, because after reworking, after reimagining, you are able to spot a change. And this change, I mean change in professional development in our country. So understanding the logic is very important, and understanding the logic we impose from the window we look at is also important. So if you take a blind spot window where you think I don't know anything, everybody knows everything, you might be able to change your logic which you had earlier. So not all swans are white. You can also spot black swans, which means reimagining is not hard to reach. To reach whatever I said as goals that we should strive to focus on and priorities that we should look at, but it is easy to ignore. And what we are currently, I assume, are doing predominantly in India as occupational therapists is we are not going towards the hardest part to reach. All we are trying to do is Okay, people are there, they will take care of it. Let's imagine saying that, okay, those are all hard things. I don't know how to do all this research. It's not my cup of tea. You know, practice, I can only handle children. I cannot go to adults. Authorities, no, no, no. We don't know anything about how India works, how Indian policies are, how it's implemented, and those people who are there in the government systems do not know who we are. So it's hard to reach to reimagine, you know, all those aspects I mentioned. But we are very happy to say, because of all these reasons, it's hard, so I'm ignoring it. So if you want to reimagine, you have to stop thinking that it's hard to reach. You have to start looking at what am I ignoring and what should I reimagine. So that's the take-home message that I have for you all to for today's webinar. I would like to say there are several reasons behind why we think it's hard to reach. You know, there are structural and institutional barriers. How an institution run occupational therapy course, how All India OT Association runs occupational therapy professional development, how they look at membership, what policies we have in terms of engagement of either we as occupational therapists or institutions who are educating occupational therapy students to look at how can we work together and then look at reimagining. So there's a structural issue. There is a cultural issue as well. We think that we know everything in occupational therapy, but we have forgotten that the science of occupational therapy is what you are actually practicing in real world, because the community or the country do not have any systems for rehabilitation. So if the government system do not have anybody to say, if you have disability and if you have problems in the hand, please go to an occupational therapist. And if the government systems do not have an occupational therapist, where will the population go for help? You know, we have not got into that cultural nitty-gritties, and we have not dismantled that. We also have methodological and logistic issues because we don't have funds to develop our profession in our country. We have to raise funds. We have to look at the logic of research, as Dr. Sendil was telling us. We got to look at developing or generating evidences for and not for practice, but for reimagining professional development in the country. We got to look at ethical and regulatory barriers in the country. We also have to look at trust relations between people who want us, between politicians who don't want us, for example, between associations who are striving towards occupational therapy professional development, and also between the relationships of people who need you and people who provide occupational therapy services. So it's kind of a big agenda that's hard to reach in terms of trust and relationship within our own community of occupational therapists in the country. So these are some of the barriers to hard to reach and barriers to easily ignore reimagining professional development in India. But should we ignore? Should we say it's easy to ignore, so let's ignore? I'm not going to give an answer to it, but I'm going to say that it's $1 million question. I've thought about this many times, and Indian Occupational Therapists think tank has been thinking about it for several years down the line now. We have not given up, and I have not given up, but we want to know from you all what could be done to reimagine. What could we do rather than ignoring all these aspects and then saying it's hard to do all those bits. That's the last slide for myself. So I would like to say that we think we know what works. You know, probably we don't know how it works, and that's the reason we don't know how to reimagine. Um, and this is for everyone. And if you look at should we ignore, I would say it's high time we start to understand what works to reimagine, because we need professional development in our country. We need occupational therapy, occupational therapists to grow and develop the science of occupational therapy and then cater to the needs of the population in India. With that, I would like to thank you all for your valuable time and active listening. I'm open to any questions or comments or concerns or even feedback. I would like to say that if you cannot ask today, if you're listening to this recording sometime later as well, if you want to contact me, those are the email IDs using which you can always contact me. I would like to take this opportunity again to thank IOTTT for thinking about this specific topic to celebrate World Occupational Therapy Day. And I would also like to thank you all once again for your patient listening. Thank you. You're not audible, Karthik. It's feeble. We can hear you, but it's very, very less.
Okay, is it better?
Yeah, it's better now.
Yeah, okay. I don't know. Like I was unmuted. Thank you so much. Thank you so much, Dr. Sureshkumar Kamalakannan, for this insightful talk. And definitely, you made us all think. You brought us into this thinking mode now. I hope like people will start thinking about what are the insights you have shared. And I could really resonate with whatever you said. And you're right. IOTT has been pondering on this, and we are not definitely, we will never give up on this. We will never ignore this. But it's high time. It's also a pivotal time for OT in India, because as you could really see, for the past 7 or 8 years, there has been like the OT schools are sprouting everywhere. And I'm like every few months I hear about a new program, I hear about a new university. So there is a lot of traction now for the field, and it's a high time that we start doing things. And definitely we would like to invite you more in the future, so that we can really hear. And then like all the programs that you mentioned, like we need to start thinking about how can we be a part of those conversation, what we need to do to get there and to get our seat at the table. Obviously we need to strengthen ourselves, we need to have more data backed up, we need more effectiveness research, we need more science behind our argument, and so on. But again, yeah, there are a lot of areas that we need to focus upon. We need to take, you know I would say, multiple step at a time, but like one group in one path, like multiple groups working on different directions, and then like culminating together with the strategy. So
Absolutely.
I could really see that. So again, to all the participants here, IOTT is willing to collaborate, partnership with individuals, with other organized professional organizations, to empower the field of OT. That's our mission. So feel free to reach out to us anytime. If you are not a member yet, we strongly welcome you to become a member of IOTTT and provide us your insights. This is for us. Okay, this is not for one or two person. This is for us. We come together to uplift ourselves. Is the concept. So with that, I'm going to like just make one announcement and then open up for questions. If you would like to receive an electronic certificate, please go ahead and put your name and email in the chat now before you leave this call. Okay. We also have this recording, so I can also verify the participants that way. But just so that I have the correct email to send the certificate to, please put it down there. And go ahead and there is a request from Dr. Kamalakannan that if you could unmute your video, like, if you could just open your video, we can take a screenshot of it. And, that
Just
will be
for a
great
celebration, we are
for our
celebrating World OT
celebration.
Day.
Please do. And then also go ahead and ask questions while we have the expert here. Thank you.
Yeah. Yeah, that's my only request, Karthik. If everybody could unmute just for a few
Just
seconds, we
for
can
five
take a
seconds,
picture.
10 seconds, just, once we take the picture, if you want to go back, that's fine. I can also like try the gallery view.
Thanks, Godandan.
Others, thank you.
Thank you, Siddhi.
Uh, Karthik, just a small info. When you're trying gallery view, please check how many tiles you can see so that number of people can be adjusted accordingly. They
Yeah.
all will fit into one screen.
Okay. Murli, would you like to go ahead and do that and take this screenshot of it?
I'm
Would you
No
be
really
able to
problem.
sorry.
do it?
I'm at my native and I'm using my
Oh,
phone.
you
I
couldn't.
tried
Okay, okay,
connecting with
got
my
it, got it.
laptop.
I can
I
do that. I
couldn't
can do
connect with
that.
my laptop.
Yeah,
Don't worry,
okay.
Karthik.
I'm in a gallery view, but I'm still unable to get everyone in one screen though. There's
I've
two
got it.
two
I've got
pages.
it.
Yeah,
I've
okay.
got it.
Suresh is going to take care of that. Thank you.
I
Asutosh,
think Suresh is in the
Hari,
laptop.
and yeah, Asutosh, Hari, Ipsiba, and Yamuna. If you could, for few seconds, if you could just switch on your screen. All right, great. Thank you.
Fantastic.
Thank you. Yes, we'll go on to the questions.
Okay. All
Yeah.
right.
Suresh, I'll go ahead. More than question, this is kind of a self-reflection. We have always had this idea of most of the times we feel we are in the right situation, we are in the right frame of mind, and we know everything. And that
Hmm.
and we always think that I may not know some things, and others may not know many of the things. We always
Hmm.
keep ourselves in a better position compared to others. But this idea of one area where the blind spot is, some of the things we might think we know, but we may not know, or we conveniently leave out from our scope to understand or to know. That's one thing where we would all, consciously have to put effort and then, get knowledge about. That's where the experts like you and Karthik come into the picture, where Senthil sir also is there. Reach out and get this knowledge. I'm really glad, the people who are there in this meeting really have put an effort into understanding this. And obviously, we'll also going forward, we'll also look into the aspect to gain more input into it and understand ourselves better. So definitely kudos to you for taking this topic and coming out for us. And thank you so much.
Thanks, Murli. Thank you for your kind words. As always, he's been my um, motivating factor. Thanks. Godandanji, yes, please.
Suresh, yeah, thanks for your seamless presentation. It was insightful. Yeah, I just want to put my question in a perspective, try my best. So to start with, so you started off with the occupational therapy, helping people to be productive and productive human being. And that's the purpose and that's the profession. And having worked in the Western country for years, and the barriers, okay, the barriers to make that possible, and then take in your window the mask, blind spot, clear, and unknown. So when you look at it, so what is the? I just want to take the barrier through those
Mhm.
windows.
Yeah.
Where is the barrier, the most barrier you think in those four windows?
I would say the barrier is more to do with we thinking that everybody does not know anything and only I know everything. This is very individualized, meaning even associations, I would say, currently, whatever is there as an association, they think that whatever we are doing is the best, they don't actually understand. If it's an educational institution, for example, they don't understand, are we providing satisfactory education so that an occupational therapist from India is graduating with confidence to say, I can be in India, I can help the people in India who needs me, and there is a system in place. So that confidence doesn't come up. I can share my own example in terms of when I finished public health. I heard from my own friends who are at that time a little bit experienced, because I worked for about 5 years and then did my post graduation in public health. And they thought, Suresh, we thought you're doing something else completely different. And if you come to the UK situation and then look at occupational therapy BSc course, which is just for 3 years, you have a small module called occupational therapy in public health, and it's in many institutions. So I think it's that specific individualized or organizational thought process where they are thinking whatever we are doing will be the best, and nobody is going to actually think that it's wrong, because that's the only association we have, that's the only organization we are looking at, and whatever we are providing is because we are doing whatever is best for you all, and you guys can actually take it. I think that's the predominant window people have. So it's opposite to the blind spot, I would say.
Thank you.
Thanks, Govindam.
I
Anyone else?
just I
Yeah,
just want to
Karthik.
add to what Suresh said. Basically, like when we come out of the OT school, we know maybe a little bit about OT, what OT is, and then like the conditions we treat, some assessments and intervention approaches, and so on. But there is a lot more to be a successful occupational therapist, right? So I think learning should never end. Learning never ends. Uh, as we learn more about, we need to learn management. We need to learn about health policy. We need to learn about system of healthcare delivery. We need to learn about public speaking. I think we need to like equip ourselves continuously with more and more skills, and when they all unite and integrate, that's when you can really become a very impactful, meaningful, and successful OT practitioner. That's what, I could reflect upon like several successful practitioners journey, including Suresh. And then learn from that. So that attitude to learn, coming out of the OT school, calling ourselves with the prefix D or whatever the Suresh said, right? Yeah, you did. That's a milestone, but that's not the end point. That's just probably the first milestone in your career, I guess. And then you continue to reach next milestone. If you want to be a successful private practitioner, you need to learn about effective supervision, delegation of work, marketing principles. So you should continue to learn all those concepts, and you can really say, what are my clients looking for? How can I promote my client satisfaction? How can I improve my quality of service? How can I improve my customer service, right? So it's beyond, it's not only about finding a space. I know what equipments I need to purchase. So sometimes I really think we try to find like a very small niche, and then we restrict ourselves there. But that's where we are missing the whole picture. And that's one of the reasons I believe, if we were to be looking at the holistic aspect of it, and then were to be very strategic, uh, given the number of years we are existing in India, our profession would have been in totally different places always. It's what always I felt. Thank you. Sorry, Murali.
I was also just thinking of adding up something, when we talk about professionally uplifting ourselves or professionally going forward and progressing in this field, there are two areas where we would need to improve ourselves. One is where how we indulge amongst our professionals, how we portray ourselves amongst professionals. Because some of the times, what I personally feel is like we block ourselves with our own mindset that okay, this person is someone younger to me, or this person is from a different institute where they have less knowledge about the field, or they are from a different part of the country or part of the world where they are less in the knowledge skill. And maybe at some point of times, yes, their resource capacity was a little less. I completely understand, but obviously that doesn't give us an opportunity to put them down or keep them in the down. And at the same time, at some point of time, we also need to understand we do not learn everything at one college or one institute or from one person. We have gained this information over the period of experience, because obviously we all understand that we are not the same person the time we graduated, or the 10 years back, or even for that matter 6 months back. We are not the same person 6 months back and now. We are evolving, and in G9's work, we are adapting our responses to each and every second of learning happens in our life. That's how it goes. The other important factor to improve our professional aspects in this fast moving world is how we have portrayed to our clients. Because sometimes what happens is we block ourselves. We don't give out clear respect as well as information to our clients. Sometimes we are very blunt in them, towards them, and we don't explain scientifically, because sometimes we don't know to explain it scientifically, or we think they don't understand the amount of information we give them. And that puts us professionally in a bad spot, because if they don't really understand as a therapist how you are working with my child, or what with my adult family member, they might not have that respect towards you, or they might not value your therapy input itself. So I would say it is important for us to understand ourselves, respect, and explain it to other professionals, as much as it is important for us to explain it and be clear towards the client population as well. That's it. Sure.
True. True. Thanks, Murli.
Siddhi.
We have Siddhi as well to speak. Yes, Siddhi.
You're
You can hear
muted.
me?
Yeah.
Yes, you
Yes.
can. We can
Yeah,
hear you.
I agree completely with what just Murli just said. And I have a few things to add on. I would just like to say some things which we could do that would help improving the situation. That you already explained what are the statistics that you already explained. So first thing is um, one thing that could be added is to have externships for students, especially in the private colleges at least, and
Mm,
have student exchange programs if possible.
mm,
So there are lots of students that. Uh, I'm in Mumbai, and here, the place that I work, I get students from other colleges that come to us for training,
mm,
and there are lots of physiotherapists who come to us
mm.
actually to our clinics because we have a multidisciplinary uh, uh, teamwork. So there are lots of physiotherapists who come as externships, and then they get an exposure to many other different where how does it work when you are in a clinic, how does it work when you, so they have postings in subacute setups, they have postings in big institutes, in hospitals, different exposures. So
Mm.
not just in the institute associated hospital, but other clinics or hospitals as well will give them a bigger view or a bigger
Correct.
understanding and lots of things to learn from management part and other things. That's first point. Second that I would want to point out is um, we can have one talk about the recent developments related to apps for documentation, for having the appointments for clinics or for the wherever the workplace is. So understanding what apps are there that professionals can use for documentation, for billing, for many other things. So the latest developments related to apps could be taught to the new students or the therapists or the current the ones which you said that have didn't have the exposure to those things. So
Yes.
related to apps can be taught to them how, because
Yes.
also the third thing, I have got a lot of the students that come to us, the newer generation, they're so apt in making reels and making with social media. So there are lots of physiotherapists also, occupational therapists also, who have their pages on different social media platforms that create awareness among general population.
Mm,
That's where we can
mm,
hit the most. So social media, how can students, how can we as individuals work on the aspect of social media? Now I actually took help. Now this is how, what just Murli said, I had to reach out to the students. I said, I don't know exactly how to make this reel, can you just tell me
mm,
what is the process? Because I can take pictures, I can take videos, I can make a make nice videos with editing and everything, but the way you're putting the sentences on it and or adding audio and everything,
mm,
how do you
mm.
really actually do? Now this I have never learned, and this now I'm trying to learn. How do I actually do it for marketing? So I see lots of therapists who are using this social media as a platform for reaching out to other millions who don't even know what OT is, right? So using on LinkedIn, whether it's LinkedIn, whether it's Facebook, whether it's WhatsApp or it's Instagram, using of making the professionals competent enough to make their own reels or ways of reaching out to people,
Mm.
having their own websites. Okay, so I have lots of clients who reach out to me via Google page. Now there are so many occupational therapists who don't even have a Google page. Okay, so getting reviews on that, getting to post on that. So even reaching out through Google page, lots of clients reach out because now the more than the patients that who reach out, it's the children of the adults or the geriatric, the
True.
children of the geriatric parents or the parents of the children who reach out to us. And these are the people whom in our generation now can just Google it up. Ki dekho, where is the so and so therapist? Let's see for the best therapist in this area, whatever, like whatever type. So that's how it pops out. So I think reaching out to us through Google page, lots of therapists don't even have a Google page and
Mm.
way of knowing how people can reach out to them at different platforms. So that's another
Absolutely.
area which I say suggest that can be taught to the next generation and the current and even us. All right. Another thing that I wanted to add was, yeah, sometimes I feel as a therapist 15, 20 years ago when I was in going through the BOT program, when we were being taught from most of the things from Pedretti and other
Probably.
books, they all had from the perspective of the Western context. Hoist was not even a concept. We had never ever seen hoist, even in the hospital that we were working, right? So,
Mm.
so many things were not even relevant to us. We were not even able to imagine how does it actually. We were seeing the pictures in the books, okay. We were not even knowing. Now the hospitals are now having trying to procure the hoists and the systems like that. So we don't. Sometimes I feel there should be chapters that are more, or books that are more relevant to our Indian context. There are a lot of things which are still not in our context. Like there are, we are trying to make places accessible, but what if the places are not accessible? What about that? How do we work on that? Because that's how I come across daily, on a daily basis, with the patients that come to us, and then we are like, okay, so the footpaths are not accessible, okay, this is not accessible, okay, so then how do we work through that? We come across people who do not live in a building that does not have a elevator, okay, as they have need to be lifted on a chair to the second floor if they have to come for therapy or not. So I suggest, oops. So I just suggest that we should have some topics also relevant to the Indian context. This is my last contribution that
Thank
I
you.
can.
Absolutely, absolutely. I've just captured all your thoughts on the chat box. So if you want to
So,
add, you can add as well, Siddhi. But thank you so much for all those suggestions. Definitely all valid, all important, and all should be prioritized by not just individual occupational therapists, but also by institutions teaching or researching or kind of enabling. Say management of the profession in the country. Thanks. We
and
have
I want to
Sendil sir.
say, Siddhi, that I
Yeah,
just want to, sorry to interject. Thank you. You gave us some good webinar topics for future. Thank you.
thanks, Siddhi. Sendil sir.
Hi, Dr. Sureshkumar. How are you?
Yes, sir.
So
All
it
good, sir.
was a wonderful, insightful session which you have done for all. But I'm just a little bit disappointed that very less than 20 numbers is joined. You have advertised many forums. This itself, reimagining. Which all the points which you have, what my thought is, all imagining instead of reimagining. So, which you quoted like all your slides, something very specifically about some slides you mentioned. Leadership, evidence-based finance, competent workforce,
Yes,
policies, and
yes,
practice.
yes,
So, what
yes.
I feel, this must be imagined presently. This is supposed to be.
Mhm.
So, reimagine in the sense of the next level, supposed to be creative, innovative, and kind of advanced research or advanced technological implementation. And in terms of advanced enrollment of all the, specifically which your topic is development in India, my viewpoint, why not we enroll in the ranking system or institution? We supposed to include a ranking system like IIT, AIMS, or medical colleges, even engineering colleges as well. But definitely our colleges or school of OT supposed to be included in the ranking systems. It might be the another era to develop reimagining in the professional next standard of education, as well as is together with the practice. So this would be my viewpoint. To I already mentioned in one a couple of years back some meeting in our professional level also. I think from Savita, Mr. Arun has done some ranking in local channels or something like this. So why not we initiate to enroll in that level for in our Indian scenarios university? Even we can suggest our WFOT level officials to enroll. All the institutions must include in the individual ranking of the colleges. It might be the next reimagining of to develop our professionals. So this I want to highlight for all. So I'm not sure whether it may possible or not. Just this is some professional intellectuals is here. Might be taken to the next
Definitely,
level.
sir. Definitely. I think the first point itself is very important to look at. Why are we reimagining? We need to imagine. So that's a very valid thought point. We need to advocate for the existing associations and organizations for professional development. And the
Think
second point
in
is
India
also
level, sorry for the interruption. In India, I think no more much priorities going in future for the association level or any kind of clubs or something like this. It might be taken into effect very soon into the national council and the state council. It might be going through the government scenarios. It might be implemented very soon because nowadays the more numbers of institution has arisen and more number of graduates has come out. It may competitions and something political areas also emerged. So instead of that, it goes into the government councils or commissions. We may indicate the through the peoples those who are involved with the committees or members. For example,
Mm.
Tamil Nadu has state level 2 members is already nominated, and in national commission almost 10 or 12 peoples is involved. So through that way, we may add in our even 5-year curriculum. We may add this point also in future. Might be work out in near future also.
Absolutely, absolutely. Sir, because you've talked about the National Council for AHP, I would like to share some hard facts here, okay? All I would like to say is the enthusiasm is needed, which is very good. We are all thinking that everything positively will happen because of NCHP. However, just reflect on RCI and then look at what has happened to that big funded important ministry-led rehabilitation program in the whole country for about 50 years now. You know, what is happening to Rehabilitation Council of India? How many professions are there? Has there been any improvement in any of the professions? You have psychology, you have speech language, you have special education. In all three, if the government had kind of was willing to develop the profession, all those three professions, imagine where we would be in the past. We've been 75 years with RCA in our country. So I think enthusiasm is important, but also a way to lead forward is what we need. So you said representatives from Tamil Nadu. So the logic that they impose, just like how I said, which is important. What do I know about professional development? How can we ensure that students are very happy after graduating, thinking confidently that I will get a job of a decent salary, WFOT actually says as a priority problem, which is salary. That is why we have shortages. And in India, how people decide on the salary for occupational therapists should not be kind of to the bottom line depending on the logic they impose. Policymakers think that 25,000 per month is enough for an occupational therapist with 4 years experience after graduation. And if I want to actually increase it to a bigger level, say managerial level, then they are looking at increasing 15,000. So on what basis they said 25,000? On what basis they said 45,000? We don't have a competency driven approach to it. And there is also something that is very important for us to understand and then push to the NCHP that we need career progression. I cannot actually say I am working as an occupational therapist today in 2025 with a salary of 25,000, and in 2045 also I will get the same salary because that's a government recognized salary scale has to move up or move down. If we are not looking at moving up or moving down and then giving a small token coin and then saying I don't know the justification, but this is sufficient. That's how it gets into the National Health Mission programs nowadays, or the ministries nowadays in terms of an occupational therapist salary. Nobody consults with state chapter or a national chapter to understand. Okay, we have a program for rehabilitation, and how much can we actually provide for this specific person? What are the roles required? What are the specifications that we need? That's not happening. They just call up the Ministry of Health, talk to the person who's actually worked on similar projects, and then we'll ask them, sir, in that specific project, what was the salary? So can I give the same salary here? So there's no evidence behind the decisions taken by these big organizations also. So I think the push should be towards all those aspects. Thank you, sir, but for your valuable suggestions. Murli.
Right. Sorry. Papa, Right. Sorry. Background.
Don't worry, don't worry.
Sorry
I
about that. Okay. So the thing what I wanted to mention was about Senthil sir mentioned ranking of colleges. What happens is, I think last time when I was in EC of IOTA, we discussed about it to promote, and the idea was, if the ranking comes into the picture, the colleges will pull up their socks and provide all the facilities and keep all the faculties for the particular number of students they have it. Unfortunately, that itself has become the negative point of the discussion, because when the FECOT, the dean of academic council, went and discussed with the principals of colleges, this is what has become like, how will we come into the ranking if this comes? Because we have lots of other difficulties. So we had to stop it, considering the colleges factor, not considering the professional aspects. There are other things involved in this. I completely agree. But I think this is being considered in NCAP not as a ranking, but as a grading system. But I think that will take a lot of time to come. But that's just the idea of people there in the NCAP now thinking about it. But we might have that grading of colleges at one point of time in the future.
True. Thanks, Murli.
But I
You're very
definitely
right.
feel that should be there, so that all the colleges are held accountable for their names and number of admissions we are taking, and going forward for that.
True. Very true.
I also thought the same. Like, Suresh, you may very well aware of this. Like, we have these R1 university, R2 universities and stuff. So if we have some sort of like a grading system, and then like say if they meet at this level, then these are the thing. So obviously then there will be a like a indirect competition in a way that you're still, all of you are good, but these are like little excellent, and so on. Very good, excellent, and so on. Like, so if we have those kind of things, that will be a good motivator for the institutions to improve the quality. But
Absolutely.
great suggestion from everyone, great input. Thank
Only
you,
only one
Senthil.
criteria behind that specific ranking suggestion, which I have from my experience, would be rank the institutions based on a satisfaction survey, anonymous satisfaction survey done by the students of that institutions. And because there are institutions which can actually pay and get the rank. Getting the rank will not be a problem. And then in India, it's never been a problem for many different professional disciplines, let alone occupational therapy. But something that can obviously work in the ranking is the students themselves anonymously rating and then sending it to a central team. I'm afraid, because whatever I'm writing, people might be able to see it from my own institution. When they see it, 4.5 years is slashed basically. So if students can provide proper feedback about what they are learning, and if that influences the rank, and if that is actually done independently by somebody else, not involving university leads, or even not involving All India OT Association, uh, I think that will be a great way forward to look at the quality of education for occupational therapy in India.
I know.
Suresh,
Go
sorry,
ahead. Go ahead.
Karthik. No,
Go
when
ahead.
it comes to NIRF and NAC rankings, there is this one component where the NAC team or the NIRF team, they send their separate links to the students, and then it is not monitored. And if they find out the colleges or universities interfering, that acts as a negative ranking for them. But trust me, I have been in the NAC accreditation committee for a university. I know how that can also be manipulated, and universities use that for a fact. But or just a Google review kind of a star system or a ranking system, which should do the best. But unfortunately, there is one negative aspect. No, there will be definitely few or very few dissatisfied students who will be the ones who are scoring negative, and that will still affect the university. It's okay, they still have that option of revoking their stars or rankings based on the comments. uh, that can be worked out. The students' feedback or the faculty's feedback indirectly or directly taken by the NCAP or a particular organization. Maybe not. IOTA may not be doing this, or even it will not be a valid one if IOTA does, because some of the colleges are members of the association, some of them are not, and no point in doing it. But NCAP, everybody will come under NCAP, so probably that will be a better option for it. I don't know if that is a possibility. Suresh, you might know better than me on this aspect.
Yeah, as I said, Murli, it's all good, but enthusiasm is good for NCAP. But I believe just reflect on another national agency which was there for 50 years in the name of Rehabilitation Council of India and what they have done for people with disabilities in the country. So we can't actually say everything will fall in place because we have NCAP, because we already had RCI 50 years ago and we have not achieved much.
Yeah, I just want to add, when we talk about all this ranking, like I'm a program director of a program here in the US, right? So we have this US World News agency kind of like doing this ranking of programs, in different fields, including occupational therapy. But like, we have some models that we could like, look upon, but it should be a third party entity. We should have an anonymity there, ensuring anonymity. There should be a integrity to the process that cannot be manipulated. We need to have a valid survey tool or like valid set of questions that kind of really like understand the metrics. I mean, my point is it doable, like given the Indian context? It is. There are some models, but it needs a lot of effort and work to come up with the integral process.
Exactly.
I just want to be mindful of everyone's time. We are well past, but it's a very great insightful discussion. Before we wrapping up, any last minute burning comments or thoughts? I don't want to cut anyone out. If there is anything, now is your chance. All right, hearing none. Thank you so much once again, Suresh, for your time and valuable insights. It's a great learning experience for all of us. Those of you who entered your email, you will receive the certificate, within a couple of days. Thank you wherever you are. Enjoy the rest of your day, and make sure that you join us for next week panel discussion on private practice. The following week we have an expert talk on neuro, and also look for a workforce survey that we are going to launch soon. Please respond to it. Thank you. Take care.
Thanks, Karthik. Thanks all.
Bye.
See you later. Bye.